The World Health Organization has put out a statement defending the way early childhood vaccination schedules are drawn up. It says the timing of vaccines is based on decades of research into when children are most vulnerable to particular diseases and how their immune systems develop. Now, the WHO spoke out after U.S. President Trump signed an executive order on Monday calling for the U.S. childhood vaccination schedule to be reduced to 11 immunizations. He also wants the combined measles, mumps, and rubella vaccine, known as the MMR, replaced by 3 separate shots. Trump argues that the U.S. should move closer to countries that recommend fewer childhood vaccines. But the WHO says national schedules are drawn up according to scientific evidence. Here's the president speaking in the Oval Office.
Effective immediately, my administration is recognizing gold standard childhood vaccine recommendations for only 11 core vaccinations against the most serious and dangerous diseases, along with the MMR, which hopefully will be split up. You have the MMR, we want it in 3 separate vaccinations, given at separate times. Together, there could be a possibility they're quite lethal, and separately, it looks like they are not at all lethal, but just very effective.
All right, joining me now from Michigan is Dr. Molly O'Shea. Dr. Molly, as she is known, has practiced pediatrics for more than 3 decades. She's also a spokesperson for the American Academy of Pediatrics. Dr. Molly, it's good to have you with us. When you read the executive order from the president, what worries you most?
There are several things that worry me. I'm concerned that families who hear the words are going to begin to question the validity and importance of vaccination at a time in the United States when we are seeing illness rates for vaccine preventable illness on the rise. We have more cases of measles right now than we have in over 31 years. So it really doesn't make sense when you look at the data to be calling into question the importance of vaccination right now. There was also a real tenor in the meeting about whether or not there's a question around the relationship between vaccines and autism, which has been thoroughly investigated and dispelled. So raising that question again is going to bring about more confusion.
Yeah, there's a lot to unpack there. I wonder, just let our viewers know that you've actually seen what a vaccine-preventable disease can do during your first month of pediatric training back in 1990, before there was a rotavirus vaccine. You say you watched an infant die from the virus. Well, this new policy...
That's exactly right.
It no longer puts rotavirus vaccination in the category recommended for every child. So when the White House calls this the gold standard, what do you hear?
Well, I'm not sure what gold they're speaking of, but the gold I'm aware of is a highly valuable substance. And vaccines are exactly that. They're something that we treasure, something that we cherish, like we cherish our children. And vaccines are the most effective way to show our children how much we cherish them, because by giving vaccinations, we ensure that they are protected and are as safe as possible during a time in their lives when they are most vulnerable. I'm old enough to have seen almost every vaccine preventable illness and have seen the benefit and safety profile of vaccines as they've rolled out and been used over the years. And there's no doubt that the science is right. Vaccines are safe and diseases are highly preventable.
The Trump administration says that the U.S. vaccinates children against more diseases than comparable developed countries. Now, I'm talking to you from Germany, which is one of the countries that the administration has used in making that comparison. I mean, is that true? And what is missing from that argument?
There are other countries that do choose to do fewer vaccines than the United States does, but their public health systems are very different. The risks are different as a result. Our public health system is quite different, and access to health care, universal health insurance don't exist in the United States in the same way that they do in other developed countries. There is also a difference in the way public health messaging is communicated in other countries. So in our public health world, as you saw in this press conference, the value of vaccination is diminished. Whereas in other countries where vaccines aren't mandated, where vaccines are talked about differently, there is a high value to vaccination, which encourages its uptake. In the United States, that's not the case. And so as a result, we both don't have the public health infrastructure and we don't have the public health support for vaccines to ensure that as much safety is had as could be.
President Trump wants the measles, mumps, and rubella vaccines separated into 3 individual shots. I mean, those individual vaccines, as I understand, they're not currently available in the U.S. Is there any medical reason to separate them?
No, there's not. They haven't been available as separate vaccines since 2009 here in the United States, and there's a reason for that. They are not as effective given separately. There's value to giving them together. You get actually enhanced immune response when given together, and there's no downside to giving them together. The immune system is robust. It's ready. It is, although babies are small and they look like they're just, kind of fragile, they are not from an immune system standpoint. Their immune system is robust and ready. And the vaccines have been designed with an infant's immune system in mind. And it prepares, the vaccines are prepared to give just the right amount of vaccine at the right time to ensure protection. So the MMR vaccine in particular is given at a time when measles, mumps, and rubella are most dangerous and will give robust response.
What happens, Dr. Molly, when you start spreading vaccinations over more doctor visits? I mean, does giving parents more choice, does it increase the chance that children simply never receive all the vaccines that they need?
Yeah, I lived through this experience. So back in like 2009 or so, or 1998 to 2000, whatever, when the Wakefield study came out, we really had the beginnings of this whole vaccine hesitancy time. There were parents who began to do vaccines differently. And what we did see is that by delaying, postponing, whatever you want to call it, vaccines, there is for sure time when kids are not covered when they need to be. But in addition, oftentimes kids never really catch up. It takes an awful lot of effort on the parents' part in a time of life when they're already very busy and have a lot of other things that they've got to get done to make additional appointments to come in and get vaccines taken care of. So it's going to happen that they aren't going to necessarily get in for all those additional appointments that their child might need. In addition, there's an unrecognized risk that is under discussed, and that is vaccine error. So when kids are receiving vaccines off the routine schedule, it requires an additional attention paid to which vaccines is a child eligible for, has enough time lapse between the previous vaccine. And that sets up an opportunity for a mishap to occur, which for a vaccine hesitant parent would be a nightmare. And that occurs much more often in children who are receiving vaccines off schedule.
Dr. Molly, we're running out of time, but I just want to ask you this notion of the connection between vaccines and autism. The president has mentioned it. Why does this idea remain so powerful despite the evidence?
I think because we really don't have here's the one answer for what autism is caused by. And that, creates this mindset around, the idea of this relationship. And because the two graphs kind of rise similarly, you want to believe it. Well, if you look at the graph of how many Starbucks stores opened, those two graphs are the same too for the number of autism rate. Well, we would never think that Starbucks stores are the cause of autism. So we have to actually follow the science, and the science is clear. Vaccines and autism are not related. And I wish I could tell you what all the reasons that autism, it has come to a larger number now, but we don't have all those answers yet. But the one answer we do have, vaccines is not it.
Okay. Dr. Molly O'Shea, spokesperson for the American Academy of Pediatrics. Dr. Molly, we appreciate your time. We appreciate you sharing your knowledge and your experience with us. Thank you.
Happy to be here.